Okay, so I'm on my way to get Botox. Well, possibly. I have a consultation, so we'll see. My face looks crazy right now because I'm going to get a facial right before the Botox. So come along and get Botox with me. Okay, I'm not going to lie. After this Botox consultation, I have the option to get the Botox right then and there or schedule it for another time, and I really want it done today, but I'm nervous I might kind of like jump the gun, so I guess we'll see if I end up doing it today. How knowledgeable I don't know what the person is called that does the Botox, but how knowledgeable she is, and we'll see, so stay tuned. Okay, so I just got my facial. My skin is super red and irritated. It always is. I have super sensitive skin. But I'm in the room waiting for my Botox consultation. I'm so nervous. First question is, how do I know if I'm ready for Botox?
Okay, how do you know if you're ready for Botox? Okay, by kind of doing expressions of your face, like raising your brows.
Okay.
If you can see the lines forming in there, you're ready for Botox, for any toxin that can kind of relax the muscles and the area. So it will prevent the lines to be permanent or to be more static.
Okay.
So
perfect. And then next is, how many units does each person need?
it depends.
Okay.
There's not kind of a set amount of units for each individual patient. It depends on the patient, the look that the patient wants to achieve, a more natural look. It depends on the amount of lines that the patient has and what we wanted to correct as well.
Perfect. And then how does Botox exactly work?
It relaxes the muscle.
Okay.
So the muscle is not going to be like really active, and therefore the lines are going to be kind of, we're going to put the muscle to sleep, kind of, in other words, so it's not permanent. So okay. Usually the muscle go back to have activity or to have like the strength again, like in a couple months after. Okay, perfect. And then, is it painful? No, it is not.
Everyone always asks that.
It is not painful at all. So we use very small needles. And sometimes what I tell patients that they need like 30 units or 40 units, it depends on the patient and the amount of lines that we want to treat. The patient thinks that they need like, I have to poke them 40 times. It's not necessary. Got it. So sometimes per area we inject like up to 3-4 units per area. Okay, perfect. And then, will my face look overdone and unnatural? Because everyone thinks that it looks fake, like a Barbie doll. No, not necessarily. Okay. If we inject on the right places and the right muscles, and to be conservative, just to have a baseline, just to start conservative treatment, you don't have to look like overdone. Perfect. And I think that is it. Thank you. Okay, so this is the after. I'm going to scrunch my forehead as hard as I can. You can see there's literally no lines. Like, there's a little here, but I don't want it to be 0 lines. And mad face, there's no 11 lines anymore. So literally all of those lines are gone. So now I'm thinking about getting Botox on my
smile line. So stay tuned and I'll show you how that goes.